So next is brief overview of arterial supply to abdominal viscera. So abdomen is supplied mostly by abdominal aorta or the branches of abdominal aorta. So arteries which supply the GI structure, they are either single or they are branched anteriorly. So three main arteries of the abdominal aorta are celiac artery, which supply the structure of the foregut, branches from the aorta at T12L1. Superior mesenteric artery supply midgut. Inferior mesenteric artery supply hindgut. You don't have to remember at which level they bifurcate. First is, let's discuss about superior mesenteric artery. So if someone has superior mesenteric artery syndrome, they usually present with postprandial pain. Whenever they eat, they will have abdominal pain. Usually old patients who are vasculopath, very, very thin, they are cachectic. Weight loss. So usually these patients can have this kind of syndrome. They will present with postprandial pain. They will be scared of eating. That's why they will lose more weight. So what happened? Superior mesenteric artery and aorta compresses